In this short lecture, we're going to be talking about putting structure to assessing and managing the critically ill patient. Now, it's fair to assume that approaching and managing critically ill patients is quite a scary task. Working as a general practitioner, especially remotely, can be a very rewarding and wonderful experience, but on occasion we will be facing critically ill patients, and that can increase our blood pressure and put us under some stress, especially when it doesn't happen very often. In the next couple of slides, we're just going to look very simply at a structure you can use to assess and manage a critically ill patient so that you don't forget things, you can assess things in a timely fashion, and make sure that you do the best that you can by your patient. And one thing we're going to say to you is that as a general practitioner, we spend a lot of time trying to diagnose problems, and what we want to do with this emergency course is move away from diagnosis and look towards managing the physiology that's in front of you. And here's the structure that we're going to look at. And it really is as easy as doctors A, B, C, D, E. It really needs to be that simple, because in an emergency, when your stress levels are up, your cognitive load goes up, it can be very difficult to remember exactly what to do in a structured fashion. So quite simply, for the remainder of this course, this is the mnemonic you need to remember. Doctors A, B, C, D. Always checking for danger. Always checking for a response of your patient, which is shouting at them, yelling at them, sternal rub to see if they respond. If you're having difficulty at that point, then send for help. Assess and manage the airway. And when you have a secure airway, move on to breathing. Assess and manage the breathing. When all the breathing issues are addressed, assess and manage the circulation. And finally, assess and manage any disability of the patient. And this ABCD constitutes what we call a primary survey. There's a video you can watch shortly of watching a doctor in the UK doing a comprehensive primary survey. And once your primary survey is complete, once you have an airway, breathing, circulation and managed any issues within those systems, you can move on to exposure, which is what we commonly call the secondary survey. Now, it's important to note that whilst you're managing your ABCD in a ordered and timely fashion, there are a number of conditions that you need to consider as a priority for your management. And the mnemonic we have for you here is SHAVED. Sugar, hemorrhage, anaphylaxis, VF or pulseless VT, epilepsy and drug overdose all need immediate management in conjunction with good airway management in order to increase the patient's survival rate. There's no point in having the best ABC structure and the best ABC management if your patient's having an acute anaphylaxis and you don't manage that appropriately. So once more, we want you to remember the doctor's ABCD pathway for any critically ill or emergency situation that you face, and always have in the back of your head, shaved, is this one of the 6 conditions in which I need to treat as an absolute priority? We will have a dedicated lecture for ABC, and we'll also have a dedicated lecture for the shave conditions that you see in front of you.